Assalamu alaikum. I am Dr. Sheikh Mizanur Rahman, Al Shifa Medical Complex, Jeddah, Saudi Arabia. Today I am to discuss about food for diabetic patient, high cholesterol patient and high triglyceride patients. Which food good for them? First I want to discuss about fruits. Fruits is essential for everybody. It's common myth that if you have diabetes, you should not eat certain foods because they are too sweet. Some fruits do contain more sugar than others, but that does not mean you can't eat if you have diabetes. Actually, you can eat if you have diabetes because fruits is essential for everybody. But you may need to eat a small amounts. Like morning, you can take in breakfast time half banana, and lunch time you can take a half apple, and dinner time you can take 1 medium orange. Like you can take 3/4 cup blueberries, 1 cup blackberries, 1/4 whole strawberries, and 1 cup raspberries. Or you can take small and make it fruit salad, and you can take. Some fruits are essential for this type of patients, like avocado. Avocado is high fat fruits and rich source of monounsaturated fatty acid. Studies have shown that instead of saturated fat and trans fat and carbohydrate in the diet, you can take avocado. Significantly reduce triglyceride level. And you should avoid saturated fat. Saturated fat found in a whole milk may raise cholesterol. You can take non-fat or low-fat milk. And you should avoid trans fat, which is found in fried food, processed snacks, baked goods like bread, white bread. You should avoid. In June 2015, US Food and Drug Administration (FDA) announced trans fat hydrogenated oil in processed foods are not safe to eat. Then carbohydrate. Some are take white paratha, some in morning, some people take lunch time white rice and dinner time white rice, but it is harmful for this type of patients, diabetes patient, high cholesterol patient and high triglyceride patients. This type of food is harmful. Like white rice has a higher glycemic index, means its carbohydrate convert more quickly into blood sugar than brown rice. Higher intake of white rice may raise metabolic syndrome. So, what is metabolic syndrome? Metabolic syndrome is a group of condition that may raise of risk of high blood pressure, high fasting blood sugar, high triglyceride level, high cholesterol. There are 7,000 varieties of rices. Brown rice is a whole grain that contains bran and jam. It provides fiber and antioxidants as well as several vitamins and minerals. White rice is a refined grain that has had this part removed, making soft and more quick cooking. 100 brown rice contains 1.6 gram fiber, but white rice contains 100 gram white rice contain only 0.4 gram fiber. Brown rice high in magnesium and fiber which control blood sugar level. But white rice, due to high glycemic index, it increase quickly blood sugar level. And brown rice nutrition is high and white rice nutrition is less, and decrease weight. Brown rice decrease weight, but white rice increase weight and increase belly fat, and and increase obesity. So, instead of white rice, this type of patient can take brown rice. If not possible to take brown rice, then can take oat. Oat is good. It is reduces blood sugar, cholesterol, and skin irritation and constipation. You can take in morning instead of white paratha, you can take oatmeal. Oatmeal with low fat milk, boiled oat, and when it becoming normal in temperature, you can add instead of sugar, not add sugar, you can add resin, and you can add honey, on teaspoon honey, and you can add nuts and half banana. Then it is a morning breakfast, very high risk breakfast. And instead of white rice, if not possible to take brown rice, you can take quinoa. Quinoa is high protein and minerals and antioxidants and anti-inflammatory properties. Studies have shown 50 gram per day for 12 weeks reduce triglyceride level. It also reduce blood sugar level. Then protein. Lean meat, you can, this type of patient can take lean meat. Lean meat are meats with a relatively low fat content. Skinless chicken, turkey, and red meat such as pork chops. Benefits: good source of protein. Lean meat is good source of protein and have fewer calories than non-lean meat. And this type of patient can take fatty fish. Fatty fish is good for this type of patients. In 2016 study, in 38 women eating 750 gram of fatty fish per week for 4 weeks, lower triglycerides and diabetes and heart disease. Seeds and nuts is more essential for this type of patients. Nuts like peanut, almond, walnut, and seeds like pumpkin seeds. Pumpkin seeds rich in unsaturated fatty acid and protein and antioxidant properties. Study has shown that anti-inflammatory food can help to prevent chronic diseases such as diabetes type 2 and heart diseases. Sunflower also contain excellent, sunflower seeds also excellent source of vitamin E, and it fight against cancer and it balance blood sugar level, and it contains polyunsaturated fatty acid. A study identify it contains conjugated linoleic acid CLA. You can get CLA in many foods, but sunflower seeds have the highest content of conjugated linoleic acid than other foods. And fenugreek seeds also very much important for this type of patients because it improve digestion and it maintain weight, that means weight management, and it lowers cholesterol and level, and it lowers diabetes level, and anti-inflammatory properties it has, and it maintain hormonal balance, and in improve skin and hair health, and in improve immune system. Garlic also very much important for this type of patient, because garlic contains anti-hyperlipidemic properties. Garlic has anti-hyperlipidemic properties. It reduces triglycerides and cholesterol. A study has shown that in 40 individuals taking 100 milligram per kg of body weight of raw crushed garlic twice daily for 4 weeks significantly reduced triglycerides. In another study, taking 2 gram of garlic powder per day, 40 days, it reduces triglycerides level. High triglyceride increases the risk of heart disease and diabetes. Black cumin seeds and a small amount of honey is good for this type of patients, because black cumin seeds contain vitamin A, C, K, phosphorus, iron and potassium. It is beneficial for good memory, balanced blood sugar level, heart health and reducing cholesterol and improving concentration. It contains phytosterols known as the fat cutters, essential for weight loss. It also alleviates joint pain and headache. Honey is a lower glycemic index than table sugar. So, a small amount of honey and a small amount of black cumin every day is good for this type of patients. Vegetables. Vegetables also very much essential for this type of patients, like cucumber is cucumber lowering blood sugar level and cholesterol. Olive oil. Research has shown that people who consume more than half teaspoon of olive oil daily have 80% lower risk of coronary heart disease and 14% lower risk of all type of heart diseases. Olive oil rich in monounsaturated fats, particularly oleic acid, which lowers this cholesterol level. And extra virgin olive oil reduces blood sugar level, because it healthy fat and phenolic compound lowers of metabolic syndrome. If metabolic syndrome lower, then it also lower blood sugar, cholesterol and triglyceride level. So inshallah, see you again. Subhanallah wa bihamdihi, subhanaka Allahumma wa bihamdika, ashhadu an la ilaha illa anta, astaghfiruka wa atubu ilayhi. Assalamu alaikum.